Cholesteatoma is basically a condition of the ear, but we don't know exactly why it's named that way because the name itself doesn't make any sense at all when it comes to describing the condition. Middle ear is something that has various kinds of epithelia. However, it does not have a keratinized one, which means something like our skin on the body. But in this condition, we see that the squamous keratinizing epithelium makes its way into the middle ear and other surrounding structures where it's not supposed to be in various ways, and that's how we have the theories. In congenital cholesteatoma, this keratinized epithelium comes into a place where there should have been mucosal epithelium. It presents with a mass behind the tympanum. In acquired cholesteatoma, we have primary and secondary. Primary is when there is no problem with the tympanic membrane, but we have something called the retraction pockets forming where they almost pierce through the tympanic membrane to enter the middle ear. Now, how did the pocket form in the first place? When the eustachian tube gets infected and blocked, negative pressure gets created in the middle ear and the tympanic membrane gets sucked. Due to this, pockets get formed most probably in the pars flaccida and the Prusac space, which is seen above the pars flaccida. Secondary cholesteatoma is when there is a hole or an abnormality in the tympanic membrane where the marginal epithelium or the annulus gets lost. Now, the epithelium in the external auditory canal can travel into the middle ear without any obstruction. This is called the Haberman's theory. Now, the keratinized epithelium can also travel into the mastoid. How? It goes into the antrum via the adytus, hence it's called as the aticoantral type. Now, there is something bad that happens when keratin gets into places. Macrophages are recruited to eat up the keratin. As a result, the macrophages turn into osteoclasts and eat up the bone. This is called active squamous otitis media. Inactive is when there is no osteoclast activity. The clinical features of cholesteatoma include scanty foul-smelling discharge, and it's smelly because of the bony erosion. And as the ossicular chains get involved, hearing loss is seen. And finally, the theories. Wittmach's theory is what talks about the retraction pockets in the posterior superior part of the tympanic membrane. Here, the outer part of the tympanic membrane is made of stratified squamous epithelium, and keratin gets laid later on in the pocket. Sare's theory is when repeated infection causes metaplasia. Reed's theory is what explains about repeated trauma where microfissures get formed in the tympanum and there is a disturbance in healing and a perforation gets formed.